Good evening, everyone. Welcome to the second night of our annual Heritage Week. Tonight we are focusing on the connection between St. Francis de Sales and medicine. You may not know, but he was fascinated with medical sciences, even willing to donate his body. He thought he was going to die when he was a university student. And he put in his will to make sure he donate his body to the pre-med department, the medical school at the University of Padua, so that his classmates wouldn't have to go rob the cemetery next door. Dr. Gregory Carolan is an orthopedic surgeon at St. Luke's Hospital, and Kimberly Fritts is a doctor of physical therapy, managing the rehab services with Lehigh Valley Hospital. So, they're going to speak about the subjects in youth, sports, and medicine, some of the contemporary concerns and issues.
So why are athletics so important? I mean, I imagine a lot of people in this room have been involved in athletics in their entire life, either as a fan or a participant. And why is athletics so important in youth? And I was able to identify, I think, a few topics that I think can maybe spur on some discussion. I think it's extremely important for young individuals to be involved in athletics if they enjoy it. My own experience with that is all I really did. I didn't do drama, I didn't do arts, I didn't do painting. I was mostly in athletics, so I can only speak to my own experience, but I think it's a very, very important part of my upbringing and something that I'd like to provide for other kids to have the opportunity to. Obviously, there's obvious health benefits of staying healthy and fit and being exercise, cardiovascular benefits, bone and metabolism benefits. There's also the obvious time management and discipline skills that are essential to teach youth in order how to manage their time so that going forward they can use those skills. I think another important point of being involved in athletics is socialization. Being members of different teams allow you to work with different people, possibly socioeconomic status that you wouldn't normally associate with. I think that's a very understood. Understood is that a word? I'm not sure. But it's something that's not as well verbalized. But that's, I think, a very important part of being on a team with teammates that are from different parts of town. You normally would not associate with them, and it's a way that you would get more exposure and become a better person. It also establishes an identity for youth. I think a lot of being young is trying to establish an identity. That's why people join fraternities when they get to college. That's why people join gangs. They want to have some sort of identity to associate with. And by being a member of an athletic team, you almost immediately have that identity, another group that you can associate with. And then setting and achieving goals is an obvious thing as well, but that's also a nice part about athletics. Whether that is a goal you set for practice, or a goal set to get on the team, or a goal to have your fastest time in the 800, or to win a state championship. Those are all goals that you learn at a young age how to set those goals and then the importance of achieving them.
So we talk about all of these different sporting activities, and when we talk about overtraining, it's really becoming the reality in youth sports. So I think that this is part of the reason that I'm not such a huge fan of specialization of sports. And Dr. Carolan and I talked about this just the other day, about what does it do to those muscles and joints of the kids that are out there and are specializing every day in one particular sport. We talk about how the body needs to move in rhythm, and the body needs to have balance. And we talk about balances between strength and flexibility. As children are growing, the reason that they're not so coordinated is because their bodies don't work in balance with each other. So we can't treat children like we would train adults, because they're not small adults. They're children with different body structures. So repetitive stretching and overuse for particular muscle groups leads to imbalance. And I guess the moral of that story is that the goal of exercise is to feel better. And if you're not feeling better, then something just isn't right. And parents really shouldn't brush off complaints that their children have, even when you think it's just whining, which is ultimately my pet peeve. But you gotta never assume that nothing is absolutely wrong, because it may be. When you think back to what our parents did, they came in, they told their parent they hit their head, they said, you don't bleeding and your head's still attached, you're fine. The same sort of thing, as long as the limb wasn't falling off, it was okay. And so I think that modern medicine has helped guide us to be able to give better care. And you'll talk with you know, maybe this is another piece of topic, but like everybody talks about the test. You know, do you need to have an MRI? Do we go directly to have the MRI done? And I know that a lot of physicians and myself as a therapist, you know, sometimes that's not the direction that we push people right now, because we actually look and say, like, are we over treating some of the symptoms that we have?